Welcome back. This is Anesthesia 101online.com. I'm your host, Siv. This episode 6, I want to say. Yes, episode 6, 106 episode. Today we're going to talk about antibiotics. This is more from an anesthesia perspective. The chart I have is from a pharmacy student that I befriended when I was doing my master's program in my dorm. So this is more geared toward pharmacy students, but I think it's relatable. So I'm going to share my screen here. Share. I'm going to go here. Yes. And I'm going to put myself down here. And I'm going to minimize this. Minimize. There we go. Okay. So on the left, you have the classifications. You have penicillin right here. It's on the left. And I'm just going to run through them. So these are time dependent here. It looks like he's written time dependent exception for enterococcus. I'm sorry, my voice is crackling. I've been under the weather, I've been sick, so I apologize for crackling of the voice. And you got natural penicillins, which is penicillin G, penicillin vitamin K added to that. And he's got here Clostridium difficile colitis is the most common adverse effect. AE is an adverse effect. And penicillin resistant ones, you got the MRSA or resistant Staph aureus and streptococci. So both of those. The most common with the penicillins, of course, is hypersensitivity, IgE mediated reactions. You get anaphylaxis, angioedema, urticaria, rash, and any macropapillars, basically raised bumps on your skin. So amoxicillin is part of them. It's part of the penicillin allergy armory. So penicillin is some cross sensitivity with the penicillin allergies, with anywhere from 1 to 10% cross sensitivity with the cephalosporins when compared to the penicillins and cephalosporins. Extended spectrum penicillins include tricaroline, primarily used to treat severe infections in combination with beta-lactam inhibitors. And then, of course, with these, because it's extended release, it causes more hepatic problems, more liver problems. So you increase your transaminase, and you become more jaundice than anything else. Here's your beta-lactam inhibitors, amoxicillin, ampicillin. Basically, this is this is unison. So ampicillin, sulbactam, is a unison. It's the brand name. So for these, you can see here the rare but serious side effects. You get hepatic, neurological, you get seizures, renal failure, hepatic problems, hematological, is leukopenia, neutropenia, thrombocytopenia. It can last anywhere up to 2 weeks for those. Moving on, we're going to talk about cephalosporins. First generations we always give to meet our skip protocol is the cefazolines. Everybody's getting cefazolin for any kind of minor procedure. So basically, before incision, 60 minutes before incision, within that time frame, that the patients have to get some kind of prophylactic antibiotics. And the usual adverse side of AE again is adverse effects is upset stomach, nausea, vomiting, and then you abuse too much of it, you get C. diff with it, C. difficile colitis. And second generation was cefoxitin, cefotetan. Is the other drug of choice that some surgeons will ask for. These are used to treat Proctor species, E. coli, Klebsiella, and gonorrhea. Same thing here. It's reiterating the point that there's some cephalosporins. So these are cephalosporins. So there's some 1 to 10% cross sensitivity with these drugs if you're allergic to them. And then third generation. So you get the first generation, which is cefazolin. Cefazolin is the drug, or Ancef, is what you always hear. And the second generation is cefotetan, or cefoxitin is the second generation cephalosporins. And then third generation, you get the ones I don't usually use all the time, cefixime, ceftriaxone is on here. Just some other ones. And then the fourth generation cefepime. It's the other fourth generation cephalosporins. And same thing, you get the rare but serious effects of hepatic, increased transaminase seizures. This is especially with the penicillins and the carbapenems. The advanced generation ones is cephalosporin. I don't think we've ever seen this. It's probably really expensive, is to what I gathered. So it's usually used for community-acquired pneumonia. It's a prodrug that goes rapid dysphosphorylation. And then it can cause renal problems, interstitial nephritis with any beta-lactam, especially nephafs, which is right about. So that's cephalosporins. And so carbapenems include meropenem. This is probably imipenem is what you usually hear in the operating room. And a broad spectrum of antimicrobials. Same thing, adverse effect is the same as penicillin and beta-lactams. There's a high dosage that will cause renal failure and predispose the patient to cause seizures and encephalopathy and irritability and confusion with these. The monobacteriums is azithromycin. I want to say Zyvox is the brand name for this. So you'll see that it's usually for gram-negative rods. So it can be given parenterally or into inhalation. No cross-sensitivity with these, with the beta-lactam IgA allergies. Next, moving on. So these are just like the side effects of each drug that we spoke about: the histamine release, urticaria, macropapillary, which is the raised skin. So there's a little epidermis, and then with the Stevens-Johnson, you usually see what the vancomycin, rapid infusion of those. And here it's more about like cross sensitivity with the cephalosporins. So the IgE-mediated reaction, you get up to 72 hours after administration. So beware that does, like my son, he's allergic to Zithromax, and we'll go through Zithromax. The difference with that is you receive the first dose, the second dose, and you'll get nothing, no reaction. But it's the third dose that he had a reaction. He actually had an anaphylactic reaction that he ended up in an ICU, the emergency room, then eventually in the ICU. So they gave him, I want to say epinephrine, Decadron, fluids, just to get his blood pressure back up. So it was quite scary because he's had before, and then all of a sudden it happened. So it can happen. This is why they say up to 72 hours, or even not even your first dose, that you can have these problems. So the fluoroquinolones, I know the name just throws you off because we're not used to calling these by group names, but these are called the levofloxacin and ciprofloxacins. That's the way they're grouped in this area. And with these, usually using gram-positive or gram-negative for cipro, and then the levofloxacin is more for gram-positive. And moxifloxacin is more for anaerobes. And then you typically use for atypical respiratory pathogens that include the pneumonia species. Just gotta be leery with these type of medications. They can cause QTC. Well, the C stands for corrected. So it's usually the QT interval prolonged. It can cause prolongation of your QT intervals. So these are drugs that can cause that. If you're taking this coupled with your quinines and procanamides, amurone, the sotadols, so just be a little leery with that. Methadone also does microslides, and Haldol can also increase this. Steroids can increase that tendon rupture. And it looks like you have a decreased substrate clearance from ciprofloxacin with the A1/2 inhibitors. And then common side effects, you get upset stomach, GI, headache, dizziness, insomnia. And like I said, with the QTC prolongation, hopefully you'll get to this point. You get to size de Pontes. So especially with the moxifloxacin, levofloxacin. So basically, it's a black box warning about tendon ruptures and pain in your joints and in your bones. So hepatic toxicity is increased because transaminase is increased. And then this is the one my son is allergic to, is the azithromycin. So the question always comes up every time I go to the doctors or the pharmacist. It's, he's going to get amoxicillin for his ear infection. And then, we never understood, but the difference in the azithromycin versus amoxicillin is it amoxicillin, penicillin, and then azithromycin, so macrolides. So as you can see, the classification is as in macrolides. It's not a penicillin family. So he's safe as far as taking that medication. If anybody's ever asked about that. So in this, the drug is, you got erythromycin, clarithromycin, and azithromycin is in the macrolides. It's bacteriostatic, time-sensitive. It inhibits the 50S subunit in any kind of the substrates of any bacteria. That's how the drugs work. Used for gram-positive streptococci species, MSSA, staph pneumonia, but it's more resistant to that. So as far as inhibitors, the CYP3A4, erythromycin has the strongest inhibitor effect versus when you compare it to clarithromycin. And same here with the QT, can be prolonged with this use of this drug. And then you got rianseroside. Like I said, we reiterating the torsade de pontis with the brachydactyly, more so with erythromycin than clarithromycin and azithromycin. I don't really see it in clinical, but it's just something to be aware of. So just keep that in mind. Hepatotoxicity is always in the back of your head too with any kind of antibiotics. Tetracyclines include tetracycline itself, monocycline, doxycycline. So these are used for gram-positive streptococci species. It's 69% absorption. So let me also look at this. Antibiotics, so they can actually, the antibiotics can be decreased when somebody's using some kind of anti-seizure med. So your serum level for your antibiotics when you're taking tetracyclines will actually be reduced because you're taking this. And if you're also on rifampin, you want to be a little leery with that. And anybody that's on kind of heart rate controlled medication like digoxin, then you want to be a little leery because it actually increases the concentration of digoxin. So something I didn't know and has come to light is that some of these antibiotics can cause some cardiac problems. So just be aware. What derivatives is the glycocycline, cyclacine. So those are another bunch of the tetracycline inhibitors. And aminoglycosides. So same thing. I always get confused when people say, "Hey, patients allergic to penicillin." So, "Oh, give them gentamicin," but you always hear the word penicillin, mycin. But gentamicin, tobramycin, amikacin, streptomycin, they're all aminoglycosides. So it's not the same. So just be aware of that. And the biggie with this, with the gentamicin, you can prolong your neurological, non-depolarizing muscle relaxants, or any kind of muscle relaxants. Actually, not correct that, because the acetylcholines that we use is based on anticholinerase. That's the way that works. So because of that, it can cause some neurotoxicities, which interferes with acetylcholine. So it's usually associated with IV rapid infusion. And be careful when you use it with myasthenia gravis patients, so it puts them at risk with prolonged paralysis with this gentamicin administration. Because I use it a lot. Other hospitals where I don't know where you guys in your practice, but you'll see that being used a lot. So just be a little leery about that. Glycopeptides, here's your vancomycin, number one used MRSA drug resistant. It's funny sometimes. The doctors will order somebody said this is not related to this, but somebody's VRE positive, they'll order vancomycin, but the initial stands for vancomycin resistance bacteria. So like you want to change something else, he's resistant, enterococci. So it inhibits the cell wall since it's the final stage of peptidoglycan and polymers. So these drugs will usually have a peak and trough for these drugs if you're taking these. So, and this is where it comes in with the red man syndrome. It's usually because you're giving it too fast, especially with the surgery. You want to get it in with that now. Ideally, you should give it in pre-op. The surgeon should order pre-op, and that way you can administer it in an appropriate time interval. So you see histamine release depending on amount and rate, of course, obviously. Especially if you're trying to give it in 15 minutes, it's kind of dangerous. And you see dizziness, erythematosus, rashes up the torso, severe hypertension, angioedema, chest pain. Usually the symptoms with red man syndrome. So basically slow down the drug, or just wait a little bit and then reinfuse. And nephrotoxicity is another problem with the vancomycins. And then, of course, but any antibiotics, the ototoxicity can happen with this. So penicillins, all that, especially when we induce patients, we almost basically slam the antibiotic into the patient as we induce. So just be careful when you do that. Here's the drugs that we see, but I don't really know the name but I know the name Zyvox. So I think I mentioned earlier that was we talked about this one here, but I don't think that was Zyvox. Like I said, this is geared toward more pharmacy students. So when it did this, so this is not Zyvox, it's different. I don't know what the brand name for this one, but I want to check that out. But Zyvox is actually this one right here. And it is there. So it's oxyzynose. Basically, it's a bactericidal against Streptococcus species. Very gram-positive, very broad, not gram-positive species for this kind of medication. It actually has a wide range where it can actually penetrate CSF. So just be aware of that. Reversible non-selective MAO inhibitors, serotonin syndrome from tyramine. So tyramine rich. So basically tyramine, what that is like sardines and fermented stuff. So pickles, smoked cheese, and pepperoni. So just be careful because you have an increase in serotonins. So you have too much of it lying around because you're taking this antibiotics along coupled with any kind of certain MAOI inhibitors. And then it can also cause bone marrow suppression. So didn't know that one either, but so just be aware Zyvox can actually cause reversible thrombocytopenia and prolonged therapy up to 2 weeks for bone marrow suppression. So just be aware of that. Deptomycin, liptopeptide. So we don't use that too much around here. It's probably really expensive. And then clindamycin is a glycoamide. So I didn't know that either. So like I said, when I got this sheet, I got this from a pharmacy student. So he's very detail oriented. So shout out to John Kim that's out there. If you're out there, thanks for the slides. This has actually helped me out during my study when we were in the master's program in the University of New England in Portland, Maine. So we're up there studying together. Thanks, John. So glycoamides, the clindamycins, sulfonamide. So this is your your Bactrim. Yeah, Bactrim is the antibiotic. So it's a combination of these two drugs. And if you, you can have bone marrow suppression with this, anemia, some kind of deficiency in thrombocytopenia with that, hypersensitivity, and some kind of renal problem. You have a high potassium. You have an increase in serum creatinine. So be aware of that. And then you have Flagyl, which is metronidazole, cause DNA sustained Briggs concentration dependent bactericidal